I'm Dr. Dima Ali. I'm board certified in cosmetic laser surgery and anti-aging medicine. I also have a skincare line called Cosmetology. I absolutely love empowering people to look and feel their best. So let's get your inner glow and outer radiance to shine bright. On today's episode, we are going to bust some Botox myths. We're going to talk about 5 different Botox-related myths, and these are actual things that I hear in the office from patients. If you like what you hear, tell us in our comments below and suggest any topics that you want to learn more about. The first one is, patient came in and said, "Hey doc, you didn't put enough Botox in my crow's feet. I can still see them." Well, Botox, the way Botox works, it's a neurotoxin. And there are only so many receptors that you can saturate with Botox. And especially if somebody has very aged and sun-damaged skin, there's only so much you're going to get to reduce that appearance. Over time, it will get progressively better, especially if you're doing collagen and elastin stimulating energy-based device treatments, for example, or chemical peels. What I tell these patients is, no, you don't need a touch-up, because those receptors are maxed out, and I could put another $100 of Botox in and you're not going to really see that much of a difference, if at all. Now, there are some instances where people do need a Botox touch-up, and I look at them and one side is taken really well and the other side hasn't. There's no problem with that. I will certainly touch it up and make it symmetric. Besides which, the idea of Botox, again, is to achieve an aesthetic balance and to atrophy those muscles that are causing those wrinkles over time so that your overall wrinkle reduction lasts over years. It's not about getting a completely frozen face. I have everybody come in that if I'm not familiar with your anatomy and you're a first timer, you're a Botox virgin, I have you come in and at 2 weeks and we assess and make sure that it's looking natural. If you have something that's imbalanced or the Spock look, we can easily fix that. And then once I'm familiar with how you respond to Botox, we're good. So again, it's about having a little bit of expression, but also affecting those muscles so that we're not making them stronger and that wrinkle deeper over time. It's nice to have a little expression in your face. That way, when you're really pissed off at your husband or your partner, they don't really know and they get super confused. So, myth number 1 busted. Our next myth: you need to ice before, during, and after Botox for purposes of minimizing pain and reducing the chance of bruising. True or false? In my opinion, you should not ice, and the reason is there are studies that show that decreasing the temperature of the skin prior to Botox reduces its effectiveness and its longevity. When we do ice is if someone is scheduled for an energy-based device treatment on the same day, because that usually will warm up your skin, and we want to bring that skin down to a normal skin temperature before doing the Botox. So in that case, I will ice, but the purpose of it is not to freeze the face. Instead, we use a little vibrating device. We keep them in the refrigerator or the freezer so they get cold. We're going to attenuate the pain by sort of a distraction method. And that tends to work pretty well. So let's move on to the next one. Skinfiction or Skinfact? Patient comes in and says, "My doctor did not do my Botox right because I am bruised." And that is definitely fiction. If you do not want to ever get bruised from Botox, then don't ever get Botox. And that will guarantee you no bruising. Generally, docs use a 31 gauge needle. I use a 33 or 34 gauge needle. A 34 gauge needle, higher number, is actually a smaller diameter needle. It is barely felt, especially with that little vibration tool that we use. So many things can cause bruising. Will I say, "I'm sorry, you can't get Botox today because you had a glass of wine tonight or you took a baby aspirin"? Absolutely not. You just have to understand. Oh shit, what happened? So if somebody is taking a vitamin E or a baby aspirin at night, or has a glass of wine the night before their Botox, that's not a contraindication to doing Botox. You just have to explain that, their risk of bruising has gone up. But then again, I've done Botox on elderly women that are on Plavix, which is a potent blood thinner, and they have not bruised at all. Besides which, if you bruise, there are so many things that you can do to make it disappear quickly. You can take a high dose vitamin C. When I say high dose, I mean like 1,500 milligrams in the morning, 1,500 milligrams at night. You can eat grapefruit or drink pineapple extract. That has an enzyme in it called bromelain, which you can actually buy, say, like at Whole Foods. There are foods you eat, there are medications you take, there are things that you drink that can cause bruising. Again, people, this is an injection. It is not the doctor's fault if you bruise when you get Botox. All right, the next one we're going to talk about, is it Skinfact or Skinfiction? Boy, do I get asked this a lot. Doc, I have an appointment with my trainer at 4 o'clock, and it's like 3 o'clock and they're getting their Botox. Do I have to cancel? Yes, you have to cancel your trainer's appointment. I mean, come on, guys. You cannot work out or do anything excessively aerobic after Botox. Now, some doctors will tell you 4 hours is enough for the Botox to take at the neuromuscular junction, and then you're cool. So, you know what? One day, out of curiosity, I did a little experiment on myself. I did my Botox, and then I went to hot yoga 12 hours later. It completely effed up my Botox. It was a disaster, and it was not something that I could fix with iodine drops or anything. I literally had to live with that. So the answer is no. You can't work out. I tell people for 24 hours just to be on the safe side. Don't bend over. Don't do any heavy lifting. Don't run 5 miles. Don't go bike riding.
Hanky Panky.
Are you on top or under? If you're on top would be okay, I think. On top and upright. For example, if I did your orbicularis oculi muscle to reduce your crow's feet, and then you went and got a facial right after. Well, guess what? This really happened, and the Botox migrated to her zygomatic muscle. It gave her a crooked smile for about a month, and then it wore off. You don't want to walk around like that, right, for a month? This is another true story. I had a patient who was a professional soccer player. She came in, so I said, "Are you sure you want to do this today?" She goes, "I have the next 48 hours off. I promise you, I'm not playing soccer. This is the best time to do my Botox." So I did her Botox at around 3:45 in the afternoon. At 6 o'clock, she got a call from her coach saying that somebody called out sick and could she fill in? And she did. And she butted the ball with her head. 72 hours later, she had a droop. What happened? That Botox migrated to the Mueller's muscle. And that muscle is responsible for keeping the eye up and open. And it migrated a little bit. And she admitted to it. She said, "Doc, I screwed up. I lied. I went to play soccer afterwards. And is there anything you can do?" Well, there actually is something that we could do. There is a medication that's used for glaucoma that's called iodine. It comes in a drop form, and I prescribed that to her. Okay, is it Skinfact or Skinfiction? You can get Botox all over your face to make you look really youthful. That is definitely Skinfiction. There are areas of the face, if you put Botox in them, you will have asymmetry. You will basically look like an alien. But again, it's so important when you're doing Botox for the practitioner to know their anatomy. Muscle groups will affect adjacent muscle groups. When I raise my eyebrows, that is a large muscle called the occipital frontalis muscle. If I put Botox in that muscle to get rid of forehead wrinkles, my brow is going to drop. I've never done Botox on a person in their frontalis muscle without first treating their corrugators and their procerus muscle. You got to take into account the fact that adjacent muscles are working together like that lever pulley mechanism. that concludes our first in a series of Is This Skin Fact or Is This Skin Fiction? If there are any topics that you want to cover or myths that you want me to bust, leave a comment below. See y'all next time.